Optimizing aesthetic results in implant-based breast reconstruction. Patient factors, surgical techniques, and adjunctive strategies. Aesthetic outcomes have become a key endpoint in implant-based breast reconstruction because they strongly influence patients' body image, psychological well-being, and overall quality of life after mastectomy. Although implant-based breast reconstruction is the most commonly performed reconstructive technique worldwide, achieving optimal cosmetic results remains challenging due to the interaction of multiple patient and treatment-related factors. The aim of this review was to identify the main factors influencing aesthetic outcomes and to summarize the strategies currently available to optimize cosmetic results. Following PRISMA principles, we reviewed the literature published between 2015 and 2025. From 747 identified articles, 25 studies met the inclusion criteria and were included in the final analysis. The studies included were mostly retrospective studies, 3 prospective studies, 2 RCT and 7 review. The number of patients included ranging from small cohorts of 50 patients to larger series of 1,000 cases. The evidence showed that aesthetic outcomes are influenced by several factors, including body mass index, skin quality, soft tissue thickness, preservation of the nipple, areolar complex, implant characteristics, implant position, radiotherapy, and surgical technique. In particular, careful patient selection and individualized preoperative planning are essential to achieve the best cosmetic results. Among the strategies to improve outcomes, the literature highlights the use of acellular dermal matrices or synthetic meshes, appropriate implant selection, fat grafting to improve contour and soft tissue coverage, and meticulous management of the inframammary fold, scars, and nipple position. In addition, prepectoral reconstruction has emerged as a valuable alternative to the traditional retropectoral approach, reducing animation deformity and often providing a more natural breast appearance in appropriately selected patients. Overall, aesthetic success in implant-based breast reconstruction requires an individualized approach that combines patient characteristics, surgical expertise, and appropriate adjunctive techniques. However, current evidence is still limited by heterogeneous study designs, emphasizing the need for larger prospective studies with standardized methods for aesthetic assessment and long-term follow-up. Optimizing aesthetic